Hi there, this is Jonathan Ginsberg, and I want to talk to you today about the strategy I use when I'm representing a client who has an HIV infection. Let me make it clear, I'm not talking about AIDS. AIDS obviously is a disease that happens after an HIV infection has not been treated, there's not been medications, and people can develop full-blown AIDS, which obviously is pretty much of a collapse of their immune system, and a lot of bad things happen, and a lot of times those cases are terminal. But HIV now is not necessarily going to always develop into AIDS. And there have been cases, and I've known clients who've had HIV for 15, 20 years, and with the proper use of medications, they're alive and relatively well. So AIDS is something that there's a listing for. I think it's 14.08. So if that's the situation, that's a different story. In those cases, I think would be approved fairly rapidly. But HIV alone is not inherently disabling unless you can show that there are other issues that are arising. And this is really a shift. I mean, I think about, I'd say 15, 18 years ago, when I would see a person with HIV, it was thought at that point that AIDS was inevitable. Judges would basically give those folks the benefit of the doubt. They would approve those cases, feeling that at some point the person was going to be terminal, and they, again, just go ahead and approve those cases. Then about 10 years ago, 8, 10, 12 years ago, judges started to see that HIV could be essentially controlled with no visible viral load with medications, with a cocktail of medications. So then we started to see judges saying, well, just because you've got HIV, it doesn't mean you're disabled, and they were denying cases in some situations. And then I'd say about the last 4 or 5 years, judges starting to recognize that people who've got long-term HIV, even if they don't have AIDS, what they do have a lot of times are infections that don't heal properly. They have fatigue. They may have appetite changes. They may have changes in their body in terms of the fat tissue in the body, a number of different things that are typically characteristic of an HIV, long-term HIV infection, medication side effects, so that those things, in addition to the HIV, can be, in fact, disabling. So when I'm looking at one of these cases, that's the environment I think we're in right now. I make sure that I emphasize to the judge that my client, is, again, with HIV, he's been compliant with his medications, but that he has developed a lot of these issues. And again, the things I'm seeing that have been very convincing to judges: chronic infections. A lot of times there will be fissures in the body, boils, things that don't heal up properly. I've had people that have had infections for 8, 9 months, can't seem to get cleared up. Fatigue is a common complaint, nausea, weight loss. So those are the sort of things that we really focus on, and we try to get a statement from a treating doctor that really talks about these other types of infections, other types of issues. And I think obviously what's going on there is that the immune system is not 100%. It's not able to deal with some of these problems. And if they're severe enough, if the person is fatigued enough, if they've got enough of these other type of problems, a lot of times it's very painful too. A lot of these issues are very, very painful. With the combination of fatigue, pain, lack of healing of infections, side effects of medications, when taken as a whole, judges are becoming more sympathetic to the notion that such a person would not be able to work. So that's really the way I approach it, is I look for all the things that have really changed in my client's life that are related to the HIV, and specifically about those things that would make it impossible for such a person to perform 8 hours a day, 5 days a week. So anyway, hope this has been helpful. Again, my name is Jonathan Ginsberg, and until next time, I'll talk to you soon.